talk about the brachial plexus today. Before going directly into the plexus, we must know what is a spinal nerve, how a spinal nerve is formed, what do you mean by plexus, and you must know a bit about the sympathetic nervous system also. So the spinal cord, the caudal part of the central nervous system, give attachment to 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal nerve are attached to the surface of the spinal cord. Okay. So how a spinal nerve is formed and how it's coming out, let's see a bit detail about this. So you are seeing this is the TS of the spinal cord. The outer area is called as the white matter and the inner area is called as the grey matter. Okay, and the inside the grey matter you are seeing this area, the central canal of the spinal cord. So the grey matter is the area where the neuronal cell bodies are located. Okay, so cell bodies are devoid of myelin sheath, hence they are grey in color. But at the outer area is called as the white matter, where the aggregations of the nerve fibers or axons are located. So you can see this grey matter has got a ventral horn and a dorsal horn. Or ventral horn is the area where the motor nuclei are located. What do you mean by nucleus? Collection of neuronal cell bodies are within the brain or spinal cord are called as the nucleus, whereas the collection of neuronal cell bodies outside the brain or spinal cord is called as ganglion, plural, singular. So in the region of the dorsal horn we have the sensory nuclei, and in the ventral horn we have the motor nucleus. Now you are seeing another small eruption here. This is the lateral horn. This lateral horn is seen only in the thoracic and upper to lumbar region. Nowhere else in the spinal cord you can see this bump, lateral horn. But there is another later in the down in the sacral region, the region of S2, S3, S4, again you may see this kind of lateral horn. That is concerned with the parasympathetic nervous system, and the lateral horn in the region of thoracic and the upper to lumbar region is the seat for the preganglionic sympathetic neuron. So this bump is due to a collection of neuronal cell bodies whose axons are leaving as the preganglionic fibers through the ventral root of the spinal nerve. Okay, let's talk about the spinal nerve a bit more detail, and we'll come back to the sympathetic nervous system later. So we can see every spinal nerve arises by a bunch of ventral nerve roots and a bunch of dorsal nerve roots. Ventral and the dorsal root or nerve roots, they unite with each other to form the trunk of the spinal nerve. The dorsal nerve root bears a small ganglion here. This is called as a dorsal root ganglion or spinal ganglion, otherwise called sensory ganglion. Here we have a collection of neuronal cell body. The speciality of this neurons over this area is that they are pseudo-unipolar cells. That means you can see this is the neuronal cell body. From there one process is coming which divides into two. Okay, one acts as a central process, other acts as the peripheral process. The peripheral process is the one which carry pain touch temperature from the surface to the dorsal root ganglion, which will be further entered into the dorsal horn and go upward to the corresponding brain center, where you are consciously perceiving the sensation. So ventral and the dorsal nerve roots unite with each other to form the trunk of the spinal nerve, which further divides into a ventral ramus and a dorsal ramus. Ventral ramus and a dorsal ramus. The ventral rami are the one which makes the plexuses, whether it is a cervical plexus in the neck region, the brachial plexus for the upper limb muscles and skin over it, the lumbosacral plexus for the muscles and the skin of the lower limb. All these plexuses are formed by the ventral rami. The ventral rami in the thoracic region continues as the intercostal nerves, which supply the intercostal muscles and a strip of skin over it. Lower 6 intercostal nerves, after supplying the corresponding intercostal spaces, enters into the anterior abdominal wall and supply the muscles as well as the skin on the anterior aspect of the anterior abdominal wall. So ventral rami in total supplies the skin as well as the muscles on the anterior aspect of the neck, the anterior aspect of the trunk, both thorax as well as the abdomen muscles as well as the skin. It also supplies the muscles and the skin of the upper and lower limb. Then what about the dorsal rami? What it do? It go backward and supply the skin as well as the muscles on the back, on the posterior aspect of the trunk. Okay, clear? Now let's talk about a bit about the sympathetic nervous system. So I told you this bump is due to the collection of a neuronal cell body. They are called the fibers arising from this neuronal cell bodies are the preganglionic fibers. Preganglionic fibers passes through the ventral root of the spinal nerve. In the case of upper limb, we can see the preganglionic fibers for the upper limb arises from the T2 to T6 the spinal segment, the T2 to T6 spinal segment of the spinal cord. What do you mean by spinal segment? The portion of the spinal cord which give attachment to nerve roots of one spinal nerve is called as spinal segment. Okay? So the fibers arising from the T2 to T6 spinal segment passes through the corresponding ventral root and it reaches the inferior middle cervical ganglion, cervical sympathetic ganglion. So on either side of the vertebral column there is a ganglionated chain that is called as a sympathetic chain. Okay, in the cervical region we have 3 ganglions: superior, middle and inferior cervical ganglion. Then in the thoracic and upper to lumbar region we have the just correspond to the number of the sympathetic fibers. Okay, so here the preganglionic fibers arising from the T2 to T6 passes through the ventral root and reaches the spinal segment, and it passes through a connection called as the white ramus communicans and enters into the sympathetic chain. It ascends up to reach the middle inferior cervical sympathetic ganglion and the first thoracic sympathetic ganglion. Okay, the synapse occurs. The preganglionic fibers meet with the make synapses with the the neuronal cells in the sympathetic ganglia. From the postganglionic fibers arises. So here you can see the fibers from this lateral horn passes all the way through the trunk of the spinal nerve, then through the white ramus communicans to reach the sympathetic ganglion. Here is the synapse occurs, the postganglionic fibers passes through the gray ramus communicans to reach the nerve root again, reach the trunk or the spinal nerve, where it partially going into the ventral ramus and partially to the dorsal ramus to reach the skin, where it supplies the blood vessels, the wall of the blood vessel. It supplies the the sweat glands. It supplies the arrector pylorem muscles. So the fibers which supplying the blood vessels are vasomotor. The one which supplying the arrector pylorem muscle in the skin is called pylomotor. The one which supplying the sweat gland is called a pseudomotor. Okay. So here you can see we are talking about the ventral ramus of the spinal cord nerve. Now you can see the red one is the sympathetic. Okay. Now you are seeing a green as well as a black one. The black one is starting from the ventral horn. So they are the motor fibers to supply the skeletal muscle. The green one is coming from the pseudo-unipolar cells of the dorsal root ganglia. So they are the sensory. So we can tell that this ventral ramus contain motor nerve, sympathetic fibers as well as the sensory fibers. So it's a mixed nerve. So the ventral ramus make the plexuses. Hope you got it. Now let us talk about the brachial plexus, the topic. The brachial plexus is formed by the ventral ramus of the C5, C6, C7, C8 and T1. Okay, sometimes the fibers may come from C4 also, then it is called prefixed. Sometimes few fibers are coming from the T2, and it is called postfixed type, usually from C5 to T1. So these are the ventral ramus are called as the root of these brachial plexus, root of the brachial plexus. Okay. Now the C5 and C6 root unite with each other to form the upper trunk. C7 is a bit aloof person, is simply continuous as the middle trunk. The C8 and T1 root unite with each other to form the lower trunk. Okay. So when you are doing a dissection of the brachial plexus, you won't be seeing the roots or the trunk. Okay, both roots and trunk is located in the side of your neck. That area is called as the posterior triangle. Okay. Now each of these upper trunk, middle trunk and the lower trunk divides into a ventral ramus and a ventral and dorsal division. This is the ventral division and the dorsal division. Ventral division, dorsal division. Ventral division and the dorsal division. Okay, like that. So this is the dorsal, this is the ventral, this is ventral, this is dorsal, this is ventral, this is dorsal, this is ventral, this is dorsal. Okay. Now this division located behind the clavicle. The division is located behind the clavicle. Now the ventral division of the upper and the middle trunk unite with each other to form the lateral cord. Okay. The ventral division of the upper and the middle, the blue ones are the ventral, these yellow ones are the dorsal. The ventral division of the upper and the middle one united with each other to form the lateral cord. Now the ventral division of the lower trunk continues as the medial cord. Now all the ventral divisions are over. What is left now? The dorsal divisions. All the dorsal divisions unite with each other to form the posterior cord. Okay. So you can see the cords of the brachial plexus passes through the cervicoaxillary canal or apex of the axilla to reach the axilla. These the roots, the cords of the brachial plexus are named according to their position around the second part of the axillary artery. That means The lateral cord lies lateral to the second part of the axillary artery. The medial cord lies medial to the second part of the axillary artery, and the posterior cord lies posterior to the second part of the axillary artery. So C5, C6, C7, C8 are the roots which unite with each other. C5 and C6 make the upper trunk, C7 make the middle trunk, C7, C8 and C1 make the lower trunk. Okay, each of the trunk divides into ventral and dorsal divisions. The ventral division of the upper and the middle one unite to form the lateral cord. The ventral division of the lower one continues as the medial cord. All the dorsal divisions unite with each other to form the posterior cord. Okay, the same thing here. So the roots and trunks are located in the posterior triangle of the neck. The divisions are located behind the clavicle. The cords are in the axilla. So we can divide the brachial plexus into a supraclavicular part, which is made of roots, trunk and division. The cords are the infraclavicular part of the brachial plexus. Okay. So here you can see in the neck there is a muscle, calenus anterior, and between the calenus anterior and medius, this what is keeping are the roots of the brachial plexus. Okay, and the divisions are located behind the clavicle. Cords are in the axilla. So the portion below the clavicle is called infraclavicular part, that is cords of the brachial plexus. Now few fibers of the branches of the brachial plexus are coming from the root. So they are from the upper trunk. From the upper trunk, two nerves are attached here. These are the suprascapular nerve and the nerve to subclavius. Suprascapular nerve 1 and the nerve to subclavius. Two nerves are attached arising from the upper trunk. Okay, same fashion, few nerves are coming directly from the root. They are not taking part in the, they are not the branches of the brachial plexus, but they are coming directly from the roots. For example, C5, C6 and C7 nerves give of few branches, few nerve fibers. They unite with each other to form the long thoracic nerve. Okay. From the C5 nerve, we can see another small branch called as the dorsal scapular nerve arises. Another few fibers from the C5, C3 and C4 make the phrenic nerve. Few fibers from the C5 also joins with the phrenic nerve. So here you can see C5, C6, C7 unite to form the long thoracic nerve. A few fibers from the C5 make the dorsal scapular nerve. Few fibers from the C5 join with the phrenic nerve. Phrenic nerve is coming from the C3 and C4. Few fibers are given off from the C5 also. Another one is the muscular branches for the longus colli and the scalenus muscle. They are the muscles of the neck. So you can see here the upper trunk is formed by the C5 and C6. The upper trunk is dividing into ventral and the dorsal division or anterior posterior division. So 1, 2, 3, 4 nerves are uniting here, plus I told you it gives off two more branches here, nerve to subclavius and suprascapular nerve. So altogether it becomes a union or meeting place for 6 nerves This point is called as the Erb's point. So let us see the branches of each cord. The lateral cord gives out three branches. They are the lateral pectoral nerve, the lateral root of the median nerve, and musculocutaneous nerve. Let us see here. Come. This is the pectoralis minor muscle. On the pectoralis minor, here you can see a nerve coming that is going to pierce the clavipectoral fascia here. This nerve is the lateral pectoral nerve. Lateral, you can see running along the upper margin here. This is the lateral pectoral nerve. Okay, other two branches. This is the median nerve. This is the axillary artery. Lateral to the axillary artery, you are seeing this big nerve. What I am touching right now. This is the median nerve. Median nerve is formed by two roots, a medial root and a lateral root. The one which is crossing in front of the axillary artery is the medial root. The other one is the lateral root. So the lateral root of the median nerve coming from the lateral cord. The third branch is the musculocutaneous nerve. What I am touching right now, this is the musculocutaneous nerve, which immediately enter into the coracobrachialis muscle. This is the coracobrachialis muscle. It enters into the coracobrachialis and comes out and supplies all the muscles for the anterior compartment of the arm. So these are three branches of the lateral cord. Now coming to the branches of the medial cord. This nerve which piercing the pectoralis minor muscle and enters into the deeper surface of the pectoralis major. This nerve is the medial pectoral nerve, is supplying both pectoralis minor as well as the major. Okay, medial pectoral nerve, medial root of the median nerve, medial root of the median nerve. Okay, then this is the axillary artery, this is the axillary vein. Here, in the gap between the axillary artery and axillary vein, you will get two nerves here. The superficial and thinner one is the medial cutaneous nerve of the forearm. The deeper one is the ulnar nerve. Okay, and medial to axillary vein, you can see a nerve here. This is the medial cutaneous nerve of the arm. So medial cutaneous nerve of the arm, ulnar nerve, medial cutaneous nerve of the forearm, medial root of the median nerve, and the medial pectoral nerve are the branches of the medial cord. Now coming to the posterior cord. Now everything has been cleared, only the branches of the posterior cord have been kept here. Okay, so here you can see a long nerve running all the way here, this nerve which supplying the latissimus dorsi. This is this whitish muscle is the latissimus dorsi. So nerve to latissimus dorsi. Okay, then lateral to this we see another nerve here parallel to it, lying between the subscapularis and the teres major. This nerve, what I am touching right now, the one which is slightly running parallel to it, but in the gap between the teres major, this is the teres major muscle, this is the subscapularis. This nerve is the lower subscapular nerve, Okay, the one muscle which is the smallest of all, which simply this one, which supplying the subscapularis muscle. This is the upper subscapularis muscle, upper subscapular. So you are seeing three nerves here in an order: upper subscapular, nerve to latissimus dorsi, and the lower subscapular. Okay, then you are seeing two nerves here. Can you see a nerve running backward like this through this? Can you see a quadrangular space here, a small square or quadrangular shape space? You can see one nerve is entering into that. That nerve is the axillary nerve. And the continuation of the posterior cord, this big nerve, is the radial nerve. Okay. So let's talk about some clinical aspect of the Erb's point. So it is a meeting point of 6 nerves. You have seen here. Erb's point is a meeting point for the 6 nerves. C5, C6, its ventral and dorsal division, nerve to subclavius, and the suprascapular nerve. Sometimes there happens some injury to this area that leads to a clinical condition called as Erb's paralysis or Erb's palsy. Okay, in that condition, you can see usually it happens due to a birth injury. In case of difficult birth, sometimes the unexperienced midwife may drag the baby through the birth canal. That lead to separation of the neck from the shoulder. That means the angle between the shoulder and the neck has got unduly increased. In that case, there happens the injury for the Erb's point. Another condition, sometimes when a person falling from the height and landing on the ground on the shoulder. Here also you can see an undue separation of the neck from the shoulder. That means the angle between the neck and the shoulder is unduly increased. That leads to the injury to the Erb's point, leading to a condition called Erb's paralysis, or otherwise called policeman's stiff hand or porter's stiff hand. In this case, you can see this affected limb will be always on the hanging on the side of the body, and it is adducted and medially rotated. Okay, hanging on the side of the body and adducted and medial rotated arm, extended elbow, pronated forearm. So this peculiar condition is called as the porter's stiff hand or the policeman's stiff hand. His policeman cannot ask you the bribe directly, so he just asking with a gesture that keep the money here. Hence it is basically called as the policeman's stiff hand. So in this condition there will be a small area of sensory loss along the lower part of the deltoid. The muscles involved are the deltoid, biceps, brachialis, brachioradialis, supraspinatus and infraspinatus and supinator are partly involved, but other muscles, deltoid, biceps, brachialis and brachioradialis, are almost completely paralyzed. Next condition is called Klumpke's paralysis. Klumpke's paralysis, here the site of injury is the lower trunk where C8 and T1 meets. The cause for this deformity is again the birth injury. Okay, and here the abduction of the undue abduction of the arm. So when a person falling from the 5th floor, usually the constructor at the construction site, the workers may face with this kind of injury accidents. He is falling from the 5th floor. On the way, he may happen to grab some tree branch or something. So his arms are unduly abducted, but the remaining part of the body is moving downwards with great velocity. That means on the journey to ground, he tries to grab something. So his body is moving down and the arm is abducted unduly, causing the injury to the C8 and T1 nerves, where it meeting the lower trunk is involved. That leads to a condition called as the claw hand, complete claw hand. Here you can see hyper extension of the metacarpophalangeal joint and flexion of the interphalangeal joints. And there will be a small area of anesthesia and analgesia, loss of sensation and loss of pain along the ulnar side of the hand and the forearm. All the intrinsic muscles of the hand and the ulnar plexus of the wrist and the fingers are the one involved, because it's coming from the C8 and T1 are the ones involved. And here the T1 is also involved. So there is an involvement of the sympathetic nervous system. If the injury is happening before the white ramus communicants leaving the T1, that goes to the sympathetic nervous system injury, that lead to a clinical condition called ptosis. Can you see the difference between the two eyes here? One is partially closed because the upper eyelid is drooping. Okay, so the ptosis means the drooping of the eyelid. Meiosis means the constriction of the pupil. Here you can see the pupil, the darker area within the iris, the most darker area is called as the pupil, that is constricted. And hydrosis. And hydrosis means loss of respiration. Respiration means the loss of sweats. Here I told you the sympathetic nerves which is reaching the skin supply the sweat glands to produce the sweat. So when sympathetic innervation is lost, no more sweat is produced on the affected area. Naturally, no sweat is produced. That area, that condition is called anhydrosis. Enophthalmos means sinking of the eyeball. You can see this eyeball is looking much sunk inside than the other one. Okay, that's all about the Horner syndrome. Horner syndrome is also seen as a part of Klumpke's paralysis when the sympathetic nerve fibers are also involved. Okay. Thank you so much. Apparatus anterior, it is called as the long thoracic nerve, otherwise called nerve of Bell, B-E-L-L, nerve of Bell, this one. Okay. Then branches of each cord. So here we'll talk about the branch of the lateral cord first. This is the lateral root of the median nerve. Okay. Then this is the lateral pectoral nerve. This is the lateral pectoral nerve. Okay. Both are branches. Lateral pectoral nerve. Okay. Then usually one nerve pierces the coracobrachialis and enters into it, and come out of it. Anyway, you can see the nerve here. This is the coracobrachialis. This is the short head of biceps. Okay, you can see the nerve is emerging from the coracobrachialis. This tiny nerve is the musculocutaneous nerve, unusually tiny in its body. This is the coracobrachialis. This is the short head of the. This is the short head of the biceps. This is coracobrachialis. This is short head of the biceps. So these are the three branches of the lateral cord. Okay. Shall we go for the medial cord now? Here. Here, this is the medial pectoral nerve. which piercing the pectoralis minor and enters into the deeper aspect of the pectoralis major. Medial pectoral nerve. So here this is the medial root of the medial nerve. Medial root of the medial nerve. Medial cutaneous nerve of the arm.
Medial cutaneous nerve of the forearm. Ulnar nerve.
Yeah, this is the medial cutaneous nerve of the forearm. This is the ulnar nerve. Okay. Ulnar nerve, medial cutaneous nerve of the forearm, medial cutaneous nerve of the arm. Medial root of the medial nerve. Medial pectoral nerve. Medial pectoral nerve. Done? Now coming to the branches of the posterior cord. This nerve which accompanying the subscapular artery, this is the nerve to latissimus dorsi. Nerve to latissimus dorsi. Okay. Now you can see a nerve which is entering into the gap between the teres major and the subscapularis. This nerve, what I am lifting right now, this is the lower subscapular nerve. Lower subscapular nerve. This is lower subscapular. This is the nerve to latissimus dorsi. On the upper part of the subscapularis, we can see another nerve here. This is only supplying the subscapularis. This is the upper subscapular nerve. Upper subscapular nerve. Okay? I'm just displacing the axillary artery to expose the other two branches of the posterior cord. This thick and the broad branch is the radial nerve, and this is the axillary nerve. So the both radial nerve and axillary nerve makes the posterior relation of the third part of the axillary artery. Okay, lying over the subscapularis, teres major, and the latissimus dorsi. Done.
Yes.
5 branches of the posterior cord for the length of the